Hello, Christy. How are you?
Hi, good.
Good. My name is Andre. I'm going to be the student nurse practitioner. I go to Youngstown State University. And for the assessment today, we're going to be doing neurological function along with your musculoskeletal.
Okay.
Should take about 15 minutes or so. Do you have any questions?
No, I don't.
All right. So starting off, we are going to test the cranial nerves 1 through 12. Starting with cranial nerve 1, this is the olfactory. So what I'm going to have you do is just occlude one side of your nose. All right, good. And tell me what scent this is.
Lemon?
All right, good. And then just close the other side and tell me what scent this is.
That is vanilla.
All right, very good. So olfactory nerve 1 is intact. Going next to cranial nerve number 2, this is the optic nerve. This tests sight. So what I'm going to have you do is just with this Snellen chart, normally this would be about 20 feet back. Can you cover your left eye for me? Good. And then just read the lowest line you can.
LTFPH.
All right, good. Now cover the other side.
Yeah, LTFPH.
Good. And then read both together.
LTFPH.
All right, very good. So vision is 20/20, which is good. Next, what I'm going to have you do is confrontation test. So I'm going to have you cover your right eye. And then not the number, but just tell me when you see my finger, okay?
I see it. Yes. Yeah.
All right, very good. And then the other side. All right, good. And then tell me when you see my finger.
Yes. Yes. No. Uh-huh.
Okay.
Now. Yes.
All
I
right,
see it.
very good. All right, so that is good. Peripheral vision is intact. And then what we're going to do is I'm going to do testing for accommodation. So I'm going to have you just look straight ahead at this pen light. All right, good. Accommodation was normal. The eye should constrict and move inward. Next thing what we're going to do is, again, just cover that left eye for me.
Okay.
All right. And then what I'm going to do is just tell me what fingers, how many numbers you see on the fingers I hold up, okay?
Okay. 2, 1, 3.
All right, very good. And then this would be done on the opposite side also. So she did well with that. For cranial nerves 3, 4, and 6, this is the ocular motor, the trochlear, and the abducens nerve. We're going to test this by doing the cardinal gazes. So what I'm going to have you do, just follow my finger, your eyes only, don't move your head.
Okay.
Good. All right, good. All right, so cardinal gazes were good, no evidence of nystagmus, and the eyes were moved in the locations where she was looking adequately. So next I'm going to do is I'm just going to check your pupils. Just look straight ahead at me. Good. All right, pupils are equal and reactive to accommodation and light, and she does have a pupil of 3 millimeters bilaterally. Checking number 5, the trigeminal nerve. Trigeminal nerve, this has both motor and sensory function. What I'm going to have you do is just, as I feel, I want you to just bite down, clench your jaw. All right, good. And then move your jaw down as I press up. All right, good. So jaw was, she had good strength. So that tests that cranial nerve number 5, and muscle tone is symmetric. Next, what I'm going to do, that was the motor function, the sensory, is what I'm going to do is testing the trigeminal nerve since it branches off and supplies the ophthalmic area, the maxillary, and the mandibular. So what I'm going to have you do is close your eyes. Just tell me when you feel the sensation.
Now. 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 Yes. Now. Now.
All right, very good. So the sensory input was normal on both sides bilaterally. Next, this is known as the corneal test. What I'm going to do is just brush right underneath your eye. All right, open your eyes for me. All right, good. So that was normal. The lateral cornea, we use this in the lower lateral cornea to evaluate corneal reflex. Both eyes should blink simultaneously if this is a normal finding, which it was. Next thing what I'm going to do is I'm going to have you close your eyes.
Okay.
All right. So first I'm going to tap somewhere. I just want you to point to where you feel it.
Okay.
Good. All right, good. Next, what I'm going to do, keep your eyes closed.
Okay.
I'm just going to tell me if you feel a sharp sensation or a dull sensation.
Dull.
Good,
Sharp.
good,
Sharp.
good.
Dull.
All right, very good. So that was good. Next, we will be checking cranial nerve 7, which is the facial nerve. Can I have you purse your lips out like you're kissing someone? All right, good. And then I'm going to have you raise your eyebrows. Good. And then smile. Show your teeth. All right, good. Puff out your cheeks. Good. And then close your eyes, nice and tight. All right, good. So cranial nerve 7, the facial nerve was intact. Here going on forward, I just want to let you know that just for the sake of time and for this video that when things are done, we'll do it on one side, but in practice, it should be done bilaterally on both sides. But to save time, we'll just do it on the one side. What I'm going to do now is cranial nerve 8 is the vestibular cochlear, otherwise known as the acoustic nerve. I'm just going to do the whisper test. So what I'm going to do is, can you close your left ear for me?
Okay.
All right. I'm going to whisper a word. Just want you to repeat it back. Baseball.
Baseball.
All right, good. And then New York.
New York.
All right, very good. So whisper test was good. It was intact. She was able to hear me. And then what I'll be doing next is known as the Weber test. So I'm going to strike this and then just tell me what ear you hear it in.
Hear it in both.
All right, very good.
Okay.
So that was good. That was a normal and expected finding. You should hear it in both ears. The next one is the Renee test. And what I'm going to do is I'm going to have you, I'm going to place this on your mastoid process behind your ear. When you don't hear it anymore, say now, and then I'm going to move it up forward and tell me if you still hear it, okay?
Okay. Now, I hear that.
All right, very good. So Weber and Renee were both within normal limits. She was able to hear adequately with those. Going on to cranial nerve number 9, this is the glossopharyngeal. What I'm going to have you do is open up your mouth and say ah.
Ah.
All right, good. So the uvula and soft palate both rise midline and symmetrically. Can you stick out your tongue for me? Good. And move it to the left and right, and then up and down. All right, good. I'm just going to have you repeat this phrase after me.
Okay.
Chubby children cheerfully chase.
Chubby children cheerfully chase.
Chirping birds in the park.
Chirping birds in the park.
All right, very good. No hoarseness in speech was noted, no difficulties with labial or lingual speech. With this one, you would also test with the glossopharyngeal nerve, you would test the gag reflex, and then if they have the ability to swallow, which we'll just verbally say that she is able to do both of those. So that tested nerves 9, 10, and 12. Then moving on to this cranial nerve 11, this is the spinal accessory nerve. So what I'm going to have you do, I'm going to place some pressure on your head. Can you turn to the left? Good. And then turn to the right. Good. And then I'm going to press on your shoulders. Shrug your shoulders. All right, good. So spinal nerve 11, the accessory nerve, spinal accessory nerve was intact, and she was able to perform that correctly. All right, so what we're going to be testing next is cerebellar function and proprioception. This helps to test, to evaluate coordination and fine motor skills. And generally, we want to look over the overall presentation when we see the patient. Just notice if there are any tics or tremors or movements, none of which were noted. And I was able to see Christy walk into the clinic today. She did have upright posture. It was smooth, regular, symmetrical, and rhythmical stride length with bilateral arm motion that was consistent with gait and no kiltering to one side or the other. She had good balance. So the first thing we're going to do, it's known as the patting the knee test. What we're going to do is just go like this with the rhythmic motion. All right, and just do that as fast as you can. All right, good. All right. So movements were smooth, rhythmical. She was able to do that correctly. Next one is going to be finger to nose. So what I'm going to do, have you touch your nose,
Okay.
and then my finger. Nose, finger, nose, finger, nose, finger. All right, very good. So movements were rapid, smooth, and accurate without any tremors noted. Next, we're going to test the lower half. So what I'm going to have you do is with your left heel, I'm just going to have you bring it up to your knee and then slide it down to your shin and then back up. Good. And then just do that again with the other leg. All right, and then back up. All right, good. So movements were straight without any irregular deviations. Next, what I'm going to have you do is stand up. This is known as the Romberg test. Just bring your feet together, and then I'm just going to have you close your eyes. And you would perform this for about 30 seconds to test their balance, which her balance is good. Next, what I'm going to have you do is spread your legs apart evenly, and then I'm just going to press on you. Don't let me push you. All right, good. So that was good. So negative for Romberg test. What I'm going to have you do next, it's known as tandem walking. So I'm just going to have you go heel to foot, going forward.
Okay.
All right, good. And then if you could do that going backwards. All right, good. And then I'll just have you take a seat. No ataxia or staggering was noted. Of course, if this were to be a positive finding, it could mean there is cerebellar dysfunction. Continuing on with this assessment, you would test sensory function. This was previously done already during the cranial nerves test. I'm going to do next, it's known as proprioception. So I'm going to have you close your eyes, and I'm going to grab your arm here, and I just want you to tell me if I'm moving your wrist up or down.
Up.
All right.
Up. Down.
All right. Up or down.
Up. Down.
All right. This would be done bilaterally, and then also on the toes and the foot. This test would be performed on both that too. Next is stereognosis. So I'm going to have you close your eyes, and with your palm out, I'm going to place an item in your hand. I'd like you to tell me, you can feel it and tell me what it is.
Okay. A key.
All right, good. And then the other hand, I'm going to do the same thing. Tell me what this is.
A paper clip.
All right, very good. So the patient was able to identify those two items correctly. And then with your hand still out, this is known as graphesthesia. I'm going to write a letter with your eyes closed.
Okay.
And just tell me what I'm writing, okay?
S.
All right, good. And then with the other hand, just tell me what you feel in your hand.
3.
All right, very good. So patient was able to do that correctly as well. Again, I'm going to have you close your eyes.
Okay.
This is known as the 2-point discrimination. I just want you to tell me if you feel 1 point or 2 points, okay?
Okay. 1, 2, 1.
All right, very good. So she was able to differentiate between 1 or 2 points, which is normal. The last one that you would test for is known as point location. This was previously done during the cranial nerve assessment. So minimal differences on each side. She was able to give correct descriptions of sensations on both sides of her body and their locations. Moving on to reflexes, we're going to be doing superficial and deep tendon reflexes. +2 is normal. So what I would do is, this is the abdominal reflex using the metal part of the patella hammer. You would run this across the patient's bare abdomen, and their muscles would contour with the direction that you are moving it. So this was done correctly and adequately. What I'm going to be doing next is your biceps, your triceps, and your brachioradialis. So what I'm going to be doing is, this is your bicep. All right, good. And then brachioradialis. All right, good. And then if you could, this is testing your tricep. All right. All right, good. And then that would be done symmetrically as well. Those were both +2 with normal reflexes. All right, and then moving on to the lower half of the body, we're going to be testing the patellar reflex. So normally they would be on an exam table, the leg would be elevated above the floor, and this would make it a little bit easier. All right, just relax your leg. All right, good. And going down, we're going to be testing the Achilles tendon, which is behind the heel. All right, good. All right, so that's good. Next thing is going to be the plantar or Babinski reflex. So what I'm going to do is I'm going to run the metal part of the patella hammer along the bottom of the bare foot. You go up the foot and then curve over around the toes. If the toes fan out, that is a positive Babinski sign. This is not a normal finding. All right, good. All right, good. So the toes did not fan out. That is a normal finding. Looking next at ankle clonus, what you're going to do is dorsiflex and plantar flex the foot several times, and then sharply dorsiflex the foot to see if there's any foot jerking once you let it go. If it jerks more than 5 times, there might be a clonus reaction. This could indicate stress on the central nervous system and can be a marker for neurological conditions like a stroke, multiple sclerosis, cerebral palsy, or a spinal cord injury. All right, so there was no oscillating movements noted. This test was negative, which is a good sign. Reflexes were +2 symmetrically and bilaterally. So this begins the musculoskeletal exam. When Christy came in, I was able to see a full 360 of her as she walked into the office. She has even contour of the shoulders, the scapular level, the iliac crest is level, and the head is aligned properly. The extremities are aligned evenly, and they are appropriate in size without any gross deformities. She has bilateral symmetry in length and circumference with her extremities. The skin and subcutaneous tissue over her main prominences are without any discoloration, no swelling or masses noted. Your muscle size is without any atrophy, no fasciculations or spasms noted. So first what we're going to do is just looking at the hands. I'm just going to show the palms. They are concave. There is a depression in the middle of your hand. Looking at the joints of your wrists and fingers, palpating the wrist. No nodules noted. Fingers are smooth and aligned properly. There are 5 fingers on each hand, total of 10. No nodules, tenderness, or swelling noted. What we're going to be checking is the metacarpal phalangeal hyperextension. So what I'm going to have you do is fan out your fingers, good, and then pinch them together. All right, good. And in the clinical setting, we would be doing this bilaterally on both sides, but for this video, we will be doing it one side. Next, what I'm going to have you do is have your have your thumb and touch the bases of your fingers like this.
Okay.
All right, good. So good flexibility there. And then I'm going to have you make a fist. All right. And then bend your wrist back and forward. All right, good. And then to the left. All right, good. And then, of course, we would do this. That was active range of motion. Passive, I would be doing it this way and against resistance. All right, good. So range of motion is intact bilaterally. Grade 5 bilateral strength and muscle tone with her hands and wrists. Next, we're going to the elbows. What I'm going to have you do is feeling her elbows for any crepitus, depreciations, masses. None are noted. Contour are symmetrical, no tenderness or swelling noted. What I'm going to have you do is just good, and then pull towards you. All right, good, and then push away. All right, good. So +5 in strength. And the wrists, I'm going to have you just pronate your wrists, and then the other way. All right, very good. Looking at the shoulders and the scapulae, I do not see any lesions, anything wrong. No crevice. For symmetry or even with contour, and as good with no notable displacements. Feeling for tenderness, shoulders are regular and normal. If you could shrug your shoulders for me, good, and then we would do this with resistance, good. That does test cranial nerve 11, and for a 5 for strength. What I'm going to have you do now is just lift your right arm up and behind and feel your back, good, and then bring your arm forward and then reach across your body. All right, good. Range of motion is intact, and then of course with resistance it would be a +5 in strength. Next, the temporal mandibular joint. What we're going to have you do is just, I'm going to feel your jaw. All right, good. And then clench jaw. All right, good. And then open against resistance. All right, good. Can you move your jaw open for me? And then left and right. And then stick forward. All right, good. Muscle strength is 5 bilaterally with that. Next, looking at the cervical neck and spine. Just inspecting the neck from the front and the back, I do notice there's no lesions, no tenderness, no redness, no warmth. The head is erect and appropriate for alignment. When she walked in, I was able to see the back of her cervical spine. It is concave and the muscles have good tone. She is symmetrical in size and no evidence of any tenderness or spasms. What I'm going to have you do for this is to touch your chin to your chest. All right, chin towards the ceiling, and then tilt your head to each side. Good. And then just move your head left and right. All right, good. And then do that again. I'm just going to do resistance. Good. And the other side. All right, good. Range of motion is fully intact. Muscle grade and tone is a +5 bilaterally. All right, moving on to thoracic and lumbar. What I'm going to have you do is just turn around for me.
Okay.
All right, so the head is positioned above the gluteal cleft and the vertebrae is straight, the thorax is convex, lumbar is concave. What we're going to do is just palpate down the spine, just noting any tenderness, lesions, masses, which I do not feel any of those. The paravertebral muscles show no spasms. What I'm going to have you do is just turn around, and I'm going to have you stand up, and we're just going to have you bend forward to touch your toes.
Okay.
All right, good. And then what I'm going to have you do is bend your waist back. Bend back from your waist. All right, very good. And then I'm just going to have you go left to right. All right, good. And then I'm going to have you turn left and right with your full trunk. All right. Again, this would all be done passive and active range of motion and with resistance also. All right. So I will have you sit down. For the hips, while she was standing, I was able to assess her hips. Didn't see any asymmetry of the iliac crest height. The buttocks was level and balanced. I'm going to have you raise your left leg towards your chest. Good. All right. And then raise that down. All right. Good. This would be done on both sides with resistance. And then I'm going to have you laterally put your left hip out and then back towards midline. All right. Good. Next, what I'm going to have you do, if you could just lay on your stomach. All right. And then what I'm going to have you do is just bring your knee and then bring your whole leg up. Good. And back down. And then do the other one, please. All right. Good. All right. And then you can have a seat. So that would be done bilaterally, and range of motion was good with her hips. So what we're going to be doing next is testing your knees. I am feeling your bilateral knees and popliteal spaces are symmetrical. The lower legs are in alignment. No swelling, tenderness noted, no masses or nodules palpated or noted, and the tibial femoral space is smooth and firm and no crepitus. So what I'm going to have you do is with this leg, I'm just going to have you kick out your leg. Good, and then bring towards the chair. Good, this would be done bilaterally and then with resistance, both passive and active. Range of motion is fully intact in grade 5 bilaterally. Next, we would be doing the feet and ankles. Inspecting your ankles while you are sitting, the malleolar prominences are smooth and rounded. Prominent heels and joints. The feet are aligned with the tibias. They are long and narrow with 5 toes on each foot. There is a longitudinal arch, and the feet face straight forward without any deviation. They are in alignment with each other with normal shape and size. And when she did stand previously, I was able to see that there was no deviations with her feet or ankles upon standing. No heat or warmth felt, no redness of the tendons or of the joints. So what I'll have you do is just point your feet forward and then point back. All right, bend your toes and then fan out. All right, good. Testing the strength of the ankles with plantar and flexion. Range of motion is intact with good strength, equally and bilaterally, rated as a 5. All right, so that does end our exam for today. Did you have any questions?
No, thanks though.
All right, have a good day.
All right, you too.